Hi Farmies, I'd like to talk to you about some medications that we use for GI irritation and inflammation. So some of the disorders that would fall into this category would be ulcers. So peptic ulcer disease would be an irritation of the GI lining. GERD, another irritation, too much acid. IBS, Crohn's, all of these are irritations of the lower GI system. So I kind of wanted to take you through these medications and how they work. So let's start with our mucosal protectant first. So meds for GI irritation and inflammation. Let's start with Sucrofate. So Sucrofate is a mucosal protectant, and it's indicated mostly for duodenal ulcers. So in the duodenum, the area just past the stomach, a lot of acid leaves the stomach and enters that area. So it reacts with the stomach acid. So here I drew a little mucosal lining and some acid, and it's reacting with that acid to form a thick paste that will then stick to the ulcers in the lining of the intestines. So we're making a thick paste, so our side effect might be constipation. And again, our treatment for constipation is always intake of fluids and fiber. And because we want to coat this to protect it, a mucosal protectant, we need to take that medication before we eat. So you need to take it about an hour before, so it has time to mix with that acid and make that gel. So you take it before you eat and before bedtime to protect your any acid production that happens while you sleep. Okay, so that's our first one, Sucrofate and mucosal protectant. All right, our next one I want to talk about is Omeprazole. It is a proton pump inhibitor. So we'll do it this way so you can see. I drew the little proton pump so you understand it's in the cells in the lining of the stomach. So another one is pantoprazole. These all end in zols. Here's another card where you can see all of these meds end in the zol. So omeprazole, which is Nexium, lansoprazole, Prevacid, pantoprazole, Protonix. You'll give a lot of Protonix IV in the hospital, and then Prilosec, which is ours, Omeprazole, over the counter. All right, so what does this do? It inhibits the enzyme that we need to make acid. So again, this one is decreasing the acid production in the stomach to decrease the signs or symptoms of ulcers in both the stomach and the duodenal area. Also treats GERD, which is, acid coming back up into the esophagus, and Zollinger-Ellison syndrome. So side effects would be GI upset, risk of osteoporosis with very long-term use. Ideally, you would make changes to your diet and figure out what's going on so you don't have to take this long-term. The way I remember that omeprazole is a proton pump inhibitor is because O and P go together, like element OP. So OP, omeprazole is a proton pump inhibitor. All right, so let's look at our next one, these H2 receptor agonists. So H2 receptors, more receptors on the inside of the stomach. The medication that we're talking about here is our ranitidine. It's a H2 receptor antagonist. So it works on duodenal gastric ulcers, GERD, and Zollinger-Ellison syndrome by blocking the H2 receptors in the stomach. And the problem with that med is that it has been pulled from the market. You remember this particular med, ranitidine, has been pulled from the market because there were levels of some cancer-causing substances found in the medication. Okay, so peptic ulcer disease, while we're still in the stomach area, can also be caused by H. pylori. So let's put that up here. Peptic ulcer disease. It can be caused by a few things. It can be caused by too much of anti-inflammatory meds. Too many NSAIDs can give you ulcers. It can be caused by H. pylori, which is a bacteria in the stomach. So remember, we have to treat the cause. So if it's NSAIDs, ulcers caused by NSAIDs, we're going to want to reduce the amount of acid and maybe use some mucosal protectant. If it's caused by a bacteria, we need an antibiotic. All right, so none of these meds that we're talking about today are going to treat H. pylori ulcers. So just kind of keep that in mind, that you have to make sure that you're treating the underlying cause. All right, let's look at the last one. It's 5-aminosalicylate, and it's called sulfasalazine. So it's indicated for treatment of the lower GI system. So IBS, Crohn's, ulcerative colitis, this is happening down in your lower GI. And what sulfasalazine does is it decreases prostaglandin synthesis. It kind of blocks that process. And by doing that, it decreases inflammation. So these are all inflammatory processes. Remember I said we were treating GI irritation and inflammation? So inflammatory processes of the lower GI, IBS, Crohn's, ulcerative colitis. By blocking prostaglandins, we block that inflammation. Some of the side effects of this medication, if you look, some blood dyscrasias, so we can have some anemia, agranulocytosis, GI upset, headache, rash. These side effects, sometimes you'll get dizziness, drowsiness, constipation, diarrhea, indigestion, nausea. You just get some GI side effects that go with this. And the way we fix that, because we don't want to stop the treatment. The medication is very effective. So say the dose is 100. I don't know if that's really how it's dosed, but I'm just giving you an example because it's easy. You have a dose of 100, and if you take it all at once, you're getting some side effects. So if 100 is causing problems, let's break it up. Let's give it to them in divided doses. So if we take 25 in the morning and 25 at lunch and 25 at dinner and 25 at bedtime, we take that daily dose and we break it up and we reduce side effects. So the effect of divided doses, let's see, divided doses equals decreased side effects. All right, so those are our 4 medications. We have one that coats the stomach. We have one that takes out the building block enzyme that is required to produce acid. We have another one that blocks acid by blocking the H2 receptors. And then finally, we have something that blocks prostaglandin synthesis, which also helps block the inflammation of these disorders. All right, guys, those are your GI meds. Have a great day.